just had an awesome session on performance management, and we're going to switch gears into data about health. We've got a great panel going today, and Chris Boone will be moderating, so I'm going to hand it over to him so we can get started.
Thank you. Good afternoon, everyone. Good afternoon, everyone.
Good afternoon.
Gosh, it's a tough group. I know it's late in the afternoon, but we have a very exciting discussion today, and this is a very distinguished panel that I have the privilege of moderating. So we're looking forward to this discussion. But the topic for today, first of all, let me say that my role, I'm the CEO of the Health Data Consortium, and we're primarily focused on the liberation and use of open health data. That's what we do. We host a meeting every year called Health Data Palooza, which is all about this stuff. But it's not going to be about me and my perspective more so than these distinguished individuals, so we're going to make it about them. But we are, it's a very exciting time in healthcare right now. You know, just a few days ago, the White House released a report talking about innovation, and they talked about the power of data to support things such as precision medicine, the Brain Initiative, education, the education revolution, or even the idea of using advanced automobiles or autopilot driving as we move forward. So the use of data and open health data is highly significant to the revolution and what we're seeing happening on that front. But today, we're not going to be focused so much on the liberation of data as we're going to be more focused on making open health data actionable. We really want to be able to move, if I had to sum it all up into one word, the key word that I'm going to use is transformation. It's really about how do you transform an organization or transform an industry using the power of data to support decision making. So these individuals are going to talk a lot about how open health data is transforming government. They're basically using, in some cases, advanced analytics, new data sources, and they're also using the power of collaboration, whether it be internally with other agencies or externally with foundations or other private sector organizations. But there's some key things that, you know, that are always extremely important when we think about building a culture using open health data, right? The key thing is that, first of all, you need to have a strategy and a vision. The second thing is that you have to be able to foster a culture of innovation. And I'm going to be particularly interested in hearing Mike discussing what they're doing in California. The second thing is really having the necessary skill set within your organization to support the use of open health data. I've talked about the idea of creating partnerships. And lastly, it's all about finding ways to quickly garner insights from that data and making it actionable. So we have several or a few high-profile leaders from health organizations at different levels of government. I'm going to start to my immediate left, your right, with introducing Jason Bonander, who is the Associate Director for Informatics and CDC's National Center for Chronic Disease Prevention and Health Promotion. In his role, he's responsible for strategic informatics planning and accountable for over 100 technology investments supporting public health science, program and operations, all of which contribute to reducing the morbidity and mortality of chronic disease in the nation. This year, his team launched chronicdata.cdc.gov, which provides easy access to well over 100 chronic disease and health indicator data sets. Next to him, we have Pat Lynch, who is a self-proclaimed open data enthusiast, who is currently a senior strategic advisor to Health Data New York, New York State's open, or I'm going to say Health Data NY, New York State's open health data portal. Prior to this role, Pat led the creation of Health Data NY, a component of Open New York, and spearheaded the state's first Health Data Codathon and Innovation Challenge. As the first state-level open health data initiative, Pat and her team, along with over 50 data transparency partners, were recognized with several excellence awards since 2012. Pat has over 30 years of health, human services, and child support experience within a variety of state and local governments. Previously, Pat developed and implemented an interagency commissioner's dashboard for NYS and local district agencies involved in the oversight of these three diverse areas. Pat is a certified project management professional who focuses on agile project management, collaboration, and innovation. All right, to her immediate left, you're right, farthest, we have Michael Wilkening, who has served as the Undersecretary of the California Health and Human Services Agency since 2008. In this role, he is responsible for 12 departments, along with various boards, commissions, and offices. Mr. Wilkening is the executive sponsor of the California Health and Human Services Open Data Initiatives and Agency Technology Governance Council. Prior to becoming Undersecretary, Mr. Wilkening served in various leadership positions in the Department of Finance. All right, so just because we're going to do this particular session a bit different, we're going to open it up with the lightning round. I'm going to give each panelist 3 minutes to disclose or to talk about something interesting or innovative that they're doing within their organizations. We're going to then move to a Q&A where I'm going to ask some very targeted questions, but I do want to reserve the latter part of this session for more town hall or Q&A from the audience. Is that fair? Thank you. All right, we'll start with Jason.
Great. Thank you, Chris. Appreciate it. And thanks, everyone, for coming today. So, a couple things I want to say first. Thanks to Chris for asking everyone to respond when he said, how's everyone doing? From Atlanta, I've become accustomed to the South where everybody says, hello, robustly. So it's nice to hear. So as Chris noted, I'm with the Centers for Disease Control and Prevention. And no surprise, and I'm sure everybody is pretty familiar with CDC, and that we are heavily a data organization, data-driven, as well as a data collecting organization. We have an unbelievable amount of data in the organization. Over the last, it's been part of our mandate for decades to collect this information. Over the last few years, when I first stepped into my role as the Associate Director for Informatics in the chronic disease area, what I found was that, and no surprise, I'm sure many people are familiar with this, individual data owners were developing their own one-off databases to put out on the website, allowing hopefully someone to find that data and utilize it somehow. When I got into this position, we had literally dozens of these scattered across the chronic disease area. When we started asking who's coming, who's getting your data, who is using your data, honestly, with a very few exceptions, nobody knew who was doing that. So we decided that it made a whole lot of sense for a whole variety of reasons to begin moving all of these individual data stores to a common platform. One, on the pure operations side, we were spending an unbelievable amount of money on these one-off data projects. Unbelievable amount. In one instance, we were spending easily $1 million a year on one particular project. And so moving all of those onto a single platform was a huge expense saver, But even more importantly than that, what we've seen, and honestly, we started working on this probably about 18 months ago and launched about April, May-ish is when we launched. And we launched with a couple people who were super interested in working with us. A couple things. One, all of a sudden we had almost every program standing at our door saying, how can we participate? How can we get our data here onto this single platform? How can we do that? Second, and equally as important, the tools that were provided allowed a lot of our main constituents, which our main constituents are states and cities, not so much individuals in the public. But what it allowed them to do was very simply grab their data from ours, snip it, cut it, and stick it in their own websites for their own constituents to use. And so we were beginning to see some traction, getting to see what people are doing, how are they using it, and getting an understanding of this huge investment in data, how it's being used, and frankly, in some ways, how it's not. So for us, this was a huge transformation, a huge and important piece, as well as moving programs away from, this is my data, and I think I know why I'm putting it out there, to having them think a bit broader in terms of who's actually using this data and why.
Thank you very much. Pat?
I'm going to build off of what was just said because it is a huge effort to get people on board, especially in health, since they're research scientists for the most part, and historically they get recognized for publishing their data. So all of a sudden releasing the data on an open data website is very, very scary. So what we did is we found a few champions in the department who really just found so much value in it. And that was our student weight and our food service establishment inspections, and a program called Genealogical Death Index. That's for another story. My first two, student weight, she went out, Rachel Roberto, and she spoke nationally. She did webinars for our schools and for the local public health departments, explained what the data was. In the data table, highlighted the 50% above obesity in red, and yellow for between 30 and 50, and under in green. We had a nice map that was color-coded too, to where the real issues of obesity were. It was very well done by our program data owner, so much so that the western part of the state is really where the issue was. And 3 or 4 of the nightly news stations picked up the news story. Well, as you can imagine in a state agency, the executives were running for cover, like, oh my goodness, what is this gonna cause? While the program data owners were ecstatic. They got the discussion of nutrition and physical ed on the table. Vending machines, what's in it for our students? Food service, quickly. We start looking at Socrata analytics, and I really applaud Socrata for the analytics. It is a wealth of information. It tells you what third-party websites are using your URL, whether they're going directly to the data set, people will review it, or is the URL to the home page. You'll get 100% bounce rate, I'll tell you right now. So you really, you just don't get those URLs embedded. You need to know what data set or map or visualization will really resonate with the key stakeholders. We found out too that startup companies started using it. Some to good uses, some to not so good uses. There's a startup for franchisors who, for their franchisees, are providing a service. Do you want to know about the quality of your franchisees? Well, we'll give you the inspection results. The National Restaurant Association has put a link to Health Data New York in their resources section. In the state of New York, you can't infer a grade. Unfortunately, there's also startup companies who want to do that, so that at least we can be proactive, know who's doing that, provide the guidance that is needed to make them compliant.
Thank you, Pat. Mike.
Right. I'd agree that that it's a huge effort to get people on board, and I'll say that I was probably among the most difficult to get on board. I was not an initial embracer of open data. The idea of it was causing me serious concern. And it's a terminology thing. Open data, when you're undersecretary, that's data breaches. That's Medicaid data has been released. You've lost backup tapes. It does nothing but get your blood pressure up. And it didn't get any better when folks started talking to me about hackers. So we had a lot of issues to get over with me before we started, and part of that we built on New York. So Dr. Nirav Shah was one of the people that talked to me about what the open data effort was in New York and what I should expect from one in California. We developed an open data handbook which was built off of New York's, and then we customized it for California. And really, our focus initially was just get data sets out. We started with the department that was most anxious to go, which was our Department of Public Health. They have a lot of data, they know how to use data, they want people to use their data. I told all of the departments, I have 12 departments, I told them all they were going to participate. This wasn't going to be optional. I'd start with those that volunteered, but when I ran out, then conscription would ensue. And we're not going to get there. We'll have all 12 departments up probably the beginning of the calendar year with at least something on the open data portal. And that's been one of the most amazing things to me as we've gone through this is this is the one issue that I have that actually goes across all 12 of my departments. So any other issues I can, food stamps, I can go between my Department of Social Services and Public Health and maybe into Department of Healthcare Services, but it's always a subset of my departments that are dealing with that issue. This is truly the one issue that I have that really does go across all. And what I've found is that there's a lot of peer-to-peer interaction that's now happening. We're about 1.5 years into this. And so it's not even an agency-driven interaction at this point. It's a lot of peer-to-peer between the departments, and we're piloting for the state. So the next will be, we'll bring up a statewide portal, and there I'm expecting to see agency-to-agency interactions and really developing bonds and conversations that just weren't there before this effort. So that's been probably the most surprising and rewarding aspect really of this, is seeing those relationships develop. We've pivoted, we're still doing the external, and I'm really focused on getting all the departments up and continuing to add data onto our portal. But the other piece that we've seen is we started asking the to what end question. Why are we doing this? And how do we sustain it? And so that's pivoted us into an internal conversation. So we're now looking at how do we use our data internally. The data that freaked me out at the beginning of this is exactly the data I want to now look at and figure out how do we use it better, but internally rather than externally, and then it'll drive external results. All of it is really culture change, and that's the difficult part. So we're having those conversations. I think having the base of the open data portal where all the departments have been talking is helping with the culture change, with those that know how to use data, talking to those who aren't maybe as skilled with it. And it's also, we're looking into the development of an innovation office, either within our agency or within the state, to really be a catalyst for change and for using technology and data.
Thanks, Mike. So this is a great segue into the discussion, because really, you hear Mike talk about this idea of getting other agencies within his organization to buy into this idea of really liberating data. And he also talked about the peer-to-peer sharing or networking as a way to increase that adoption. So you're essentially, that seems to be your key strategy to changing the culture within the organization. What are your thoughts about that?
Yeah, I couldn't, I can initially tell all the departments that they're going to participate. I mean, they all report into agency. We can do that. If the secretary and I decide that's a priority, then they'll do it. But it really did get to that sustainability issue, and that has to come from inside the departments. They have to see value in this, and it also is a lot of effort. So if it's going to be driven from me, there's a limited amount of time and attention I have, and so having this peer-to-peer interaction allows me to really federate it and make sure that other people are buying in, and that then the ability to really implement is much greater than if I'm just driving this from agency.
Pat, I'm interested in hearing your thoughts about culture change and shift when it comes to open data. What are your thoughts?
What's in it for them is basically what I left here from the last summit. There was that Xerox slide and how the copier machine is no longer a key piece of equipment. And the speaker summed it up by saying the company did not stay true to their internal customers and understanding what their needs were. And that's what we're really starting to do too, as California is. How are we doing this? Well, they go for grants all the time. They want to do public health messaging. Our biggest value is how is the data that they're spending so much time on putting on Health Data New York, how is it being used out there? Providing them with input. October 15th, another local evening news station did interviews with school cafeterias based on food service inspection results. And they put it in really layman's terms, like that dented can could cause botulism. So I think understanding that we can liberate the data, start visualizing the data with our internal partners to say what the public health message should be, but also leave it to others, like the journalists, to help us with some of those critical compliance issues that public health really isn't thought about until something goes wrong.
Jason, I'm curious. I mean, your organization has published data for decades, and so it's not new to you. I mean, what do you see as how do you change the paradigm within CDC to promote this?
Honestly, so again, for us, since we have been publishing data for decades, it wasn't hard. Honestly, it really wasn't all that hard to move everyone to a singular place to do that, because for the most part, they saw some out of the box, some pretty clear cost efficiencies in doing that, because they were already spending a lot of money in more complex and less usable solutions. So that wasn't the hard part. I think the harder part, and so a couple things. One, the harder part for us has come now that it's easily accessible, which is fine. How do we make it easily usable? How do we help our data providers understand how it's going to be used, that it is likely going to be used outside of their control, but also to pair them with others. So we participated in June in the National Day of Civic Hacking, which of course freaked everyone out in our center at CDC. They heard hacking and everybody went crazy. But what we found, and not terribly surprising for folks, was that we had our program as a tobacco use policy data. They were extremely interested. They had a few ideas of some issues they were interested in solving, and so put the data set out there for folks to use. And a very naive activity, super naive activity. We just assumed that everybody would understand the 35,000 or 70,000 rows of complex data and be able to derive something interesting out of that. And what we found was that it was really important to marry subject matter experts who really knew the data with people who wanted to do something interesting with the data. And so we're really moving beyond, or at least in many areas, the culture of mine.
Yeah.
And moving into the culture of how to use it well in different circumstances.
Yeah, I mean, that's a great segue into another question I had. Mike, you mentioned that you guys are establishing an innovation office. Mm-hmm. I mean, what does an innovation office look like? What's its primary objectives? And what do you envision this group ultimately accomplishing for you guys?
So we're literally just starting to look at what it would be like. We have a fellow that we just brought in, and the first task that he has is to really look at innovation offices internationally and domestically, and what works, what doesn't work, where are the challenges, what's the format look like, permanent staff, fellowships, so what I'm hoping to drive from it is really to have a center where people can bring problems and where they can prove out approaches, and really be a catalyst for the cultural change that I think we need in order to actually sustain the open data movement inside of the.
Is that like use cases that you're thinking?
Yeah.
And so I'm particularly interested in when you say they're looking at other organizations. Is that other government organizations or private sector organizations when you're saying they're trying to model the innovation office? What do you?
They're going to start with the governmental organizations, but haven't ruled out looking at the private as well.
Are there many out there right now?
Well, there's 18F, USDS, a couple of San Francisco's doing some stuff in innovation. So there are different models. The United Kingdom is the one that kind of started it all. So there are those out there, and just want to see what's there and what's working and where their challenges have been before, because we're going to have to do a request to the legislature to have it established. And so I want to have a couple of use cases that we've proved out to show that the approach works and a structure, and then try to get that through the legislature.
It's perfect. Pat, so what are you guys doing? You obviously have an issue with hackers who are using your data. Do you have an innovation office, or how are you engaging your data customers?
Well, we had a hackathon and an innovation challenge in 2014 and 13. And what we did was bring in not only the developers and our program staff, as was just described, we brought in over 50 people from our community, public health. We brought in practitioners, we brought in consumer advocacy groups, we brought in the hospital associations to start a dialogue about what is the importance of open data, what worries those organizations and individuals about open data. You know, when we had our first hackathon, one of our program managers, as she's walking in, she said, "Why did you invite me? You know, this is about hacking and open data." And after 2 days of open data experts speaking and the community health giving their examples of how they use data and what they do every day, she left and she said, "Now I get it." And that's what we all need to do, is get the word out. Another way to get the word out, we had an innovation challenge in our winner, DocSpot. We were funded by the New York State Health Foundation and the Robert Wood Johnson Foundation. And when Dr. Shah first went to the foundation, they said, "All right, Dr. Shah, you have all these ideas, we'll go with it, but we don't know where this is going." And at the end of it, they appreciated the discussions, the luminary talks, but they also had us come in and debrief their entire staff about the winning applications. And I was inspired by your speech at Health Data Consortium, and I kind of borrowed it when I went to the foundation. And I talked personally about how I use DocSpot, which was our winning application. This startup company, even though we put hospital inpatient cost, quality, and efficiency data out there, their perspective was it starts with the doctor. The doctor saying what the procedure is, what the surgery is, and then the hospital. And usually the hospital is dictated by where the doctor practices. So in my family, a week before Christmas, we found out that one of our family members, they had a cough for a while, and they went into urgent care. And the next thing, they were put into isolation because they thought they had TB. The next thing, they're in an ambulance going to Albany Medical Center. And then we find out it's 4th-stage colon cancer, and there isn't many options. And there's an oncologist standing there with the family, and you're like, okay, I don't have much time to research, go call my friends and family to see if this doctor is helpful. But we brought out DocSpot, found out they did their residency in Sloan Kettering, had no professional medical misconduct, and that they also, colon cancer was their area of expertise. So we were all relieved. That's the stories, too, that we all have to get out there about data, because a lot of people just don't understand what open data means to them.
Thank you, Pat. All right, so we have about a little less than 10 minutes. I want to make sure I open it up to the audience so that you can ask any questions you may have. If you don't, I'll continue to fire away because I have a ton of them. Please, would you stand up and say your name and who you're with and question?
How are you using your open data portal? How are you intentionally tying it to some of the larger health initiatives like Healthy People 2020 or Healthy California 2020, so that the data is purposeful and starts to drive some of those strategies?
So we launched Let's Get Healthy California 2012. And that was an executive order to make California the healthiest state in the nation. And the secretary has been the point on that. So she pulled together a group of people to figure out strategies and indicators relative to that. There's 39 indicators that they came up with. I had kind of launched the open data portal and have been the champion of that. This last within the last probably 6 months, we started looking at these two efforts and saying, why are we siloing these efforts? It's really the same thing that we're trying to do. So we've got innovation challenges going on in Let's Get Healthy California right now, culminating in a January convening in Sacramento. And then we do an Open Data Fest in March. This will be our third one. And so what we're doing is we're trying to bridge between those and really engage at the local level in between the two convenings to really dive deeper into the interactions that we have with the locals and what is it that they want, what do they need, what value do they see in what we're doing, how should we be pivoting. So really expanding the dialogue and at the same time trying to pull the various efforts that we have together into a more cohesive whole.
Thanks, Mike. Any other, please?
Hi, Jason. I'm David Hale at the National Library of Medicine, and I'm trying to start a similar project at the NLM. And even though we're very nascent, quickly other data owners and divisions have fallen into either this is great, you're going to do all this open data work for us, and wonderful, you do it. And then the groups that say, oh, no way, this is mine, you don't understand it, I have my API that uses this 20-year-old syntax, and that's the best thing, and there's just no way you can understand this. So what strategies did you find worked with those harder to reach groups?
So great question. To be perfectly honest, at this point in time, I don't care about those harder to reach groups. Just being brutally honest, we have enough people who are coming to us right now who are interested in utilizing it, that by the time we get through all of those folks, there will be a critical mass that it'll be hard for people to say, well, I don't want to participate in that, when the evidence is showing that everybody else, well, it's not everybody else is, but also what we found was that the simplicity of using the platform, that when individual data owners were creating their own databases and using their own stuff, that they were relying heavily on other contract staff, other people to help them manage the data, clean the data, put up the data, take down the data, clean it, put up the data, take down the data. And what using the platform what enabled us to do was cut a lot of that middle layer out. The data stayed in the hands of the data owners. They could work it the way they needed to work it. They could put it in the platform. They could see it in staging. They could see how it looked. It didn't look right. Bring it back down, work it again. It was all within their own control. And that was a huge seller for a lot of folks, was that actually you're really not losing any control. You're actually, in some ways, you're gaining more. So,
Thanks, Jason. Any other questions? All right, well, no other questions. So I'll just, one question I have, and it's building on the question, I'm sorry, I'm blank on your name, you just said it. Trudy. And it's really around this idea of completing the feedback loop, right? And I'm particularly interested in hearing, building on what Mike said about using the data, applying it to actual policy, or using it to inform policy in some ways. Do you guys have any examples, or do you have a vision for how that would work? Let's start with you, Jason. Of course.
Thanks, Chris. Thank you. So when I think of the data that we have, again, in the Chronic Disease Center, very different from data that's in infectious disease. So infectious disease very much feels closer to home. It's immunization rates, it's HIV testing centers. There's a lot of that data that can be brought super local. The data that we have in the chronic disease area very much it's at a larger level, it's more at a population level. And so one of the things that we know has always been the case, but what we're hoping to see in the open data platform is, since it's much easier to use, that more and more of our state, city, and county partners will have access to that data to help them inform the kinds of policy, system, or environment changes that they want to make to improve the health of their communities.
Pat?
From a policy perspective, we're moving to what we're calling digital transparency strategies. And we're realizing we can't do it all. And it's good to get the data out there, but to entice people to use the data, we have so many different stakeholders, journalists, to consumers, to families, to communities, and to figure out by each of the data sets working with our program areas, what is their public health messaging that they want to do, and who are the key stakeholders, realizing we're not going to reach everyone. Let's start with the first 2 use cases and figure out what's the best visualization tools or simple query tools. I think when we first, we've been doing this since 2011, we thought the platform is, in itself, offers a lot of great tools that we never had before in standardization. But some of the visualizations are not good for consumers. And going out and using other tools, open source tools, YouTube, putting more context about it, data stories, I'm looking forward to it. So just trying to understand more, how do we get data in the format that people will actually use it in some action?
Thanks, Pat. 60 seconds.
So I'd say the best example we have is in the measles outbreak that we had in California, where we started seeing stories in the media where they were using the Department of Public Health's immunization rate data, and they were actually figuring out where the high immunization rates were, which counties, areas had high immunization rates, which had low, and really then diving into why do we have those disparities became a series of stories in California, and then also became a topic as legislation was moving through the legislature on requiring immunizations. So it was a good example of the data being out there and people accessing it and helping to shape the story.
Thank you. All right, so in closing, there's a few key lessons I want you to walk away with at the end of the day. And based on what the panelists told me and shared with the rest of us, is that you need a vision. There's going to be some cultural shifts that are necessary to make this work. Mike has gone as far as to build an innovation office, which I think is a great idea. There's definitely an extent of collaboration or community building, and they're doing that through peer-to-peer, whether it be agency to agency or even externally. So there's opportunities for you to do that. There's immense power, as Pat indicated, in storytelling, actually identifying very targeted use cases that show and demonstrate how the power of the data is being used and measuring that impact. And last but certainly not least, there's an opportunity to really connect it to an existing policy initiative or potentially one that has not been thought of yet because you're introducing a problem based on the data. Can I get a round of applause for our panelists? Thank you all, and enjoy the rest of the meeting.